Stephen is a 28-year-old Māori man admitted to ED intoxicated with injuries sustained in a motor vehicle accident. He has 3 prior drink driving convictions. The police have been called to his home a number of times because of alcohol-fueled domestic violence. Stephen's marriage is under stress and their children's mental health and schooling are suffering. Stephen is admitted to ICU because of the extent of his injuries and stays in hospital for 13 days, a total cost of $35,226. Later, when Stephen goes to court for drink driving, he is seen by the Alcohol and Drug Court assessor and, following her recommendation, is sentenced by the judge to attend alcohol and drug treatment. After a group program, he goes to residential alcohol and drug treatment for 14 weeks, a total cost of $23,912. Stephen's total treatment cost comes to $59,138, excluding outpatient treatment. Stephen's alcohol and drug problem started when he was 14, drinking and using cannabis with family and friends. By the time he was 16, Stephen had attended a number of health services, including the family GP, his school public health nurses, the emergency department, and an adolescent health clinic. Imagine how different things might have been if Stephen's alcohol and drug problem had been identified at one of these services and he had been referred to the Alcohol and Drug Helpline. So how typical is Stephen's story? Northland DHB Mental Health and Addiction Service research indicates that in 2010, 80% of 16-year-olds in Northland binge drink like Stephen did. Between November 2011 and October 2012, 31% of people coming to Whangarei ED with an alcohol-related injury were between 19 and 24 years old. By comparison, people present to alcohol and drug treatment at a much later age. 30% of Northland callers to the Alcohol and Drug Helpline are 35 to 44 years old. There are at least 10 years of health and social costs resulting from alcohol-related harm in Northland, which can be prevented if we can reduce the age at which people receive alcohol and drug treatment. Northland has been chosen by the Alcohol and Drug Helpline as a demonstration site. They provide their services to us for free. Initial training and setup in one health service is estimated to cost $640, and that includes travel, with an additional ongoing estimate cost of $7.50 per 15-minute intervention. Stephen's health costs exceeded $59,000. In partnership with the Alcohol Drug Helpline, the Northland District Health Board has an opportunity to provide further support for individuals and communities, and in turn reduce the clinical costs and social impacts alcohol and drugs have on Northland. Early intervention works. Referring patients to the Alcohol Drug Helpline and ED saves money and lives. Call 0800 787 797.